People come to physical therapy for shoulder problems for two primary reasons. Number one, pain, and number two, which is probably more importantly, is the loss of function. At least 25% of my day is spent specifically on shoulder issues, whether it's post-surgery rehabilitation, if it's pre-surgery rehabilitation, or maybe after an injury and accident. Often we work in conjunction with the orthopedic surgeons. The patient might go to see the doctor, and the surgeon will perform a thorough assessment, and often they'll make a decision, hey, let's try some physical therapy to see if we can avoid surgery. We call rehabilitation prior to surgery, we call it prehab. And that is sometimes what we'll do with a patient to try to strengthen other surrounding muscles, try to get back range of motion prior to the surgery to help the outcome after surgery. Trying to get the arm moving through the full movement, to reach up, reach down, out to the side. One of the big functional movements we work on quite a bit is reaching behind the back. Think about how many times you want to tuck a shirt in, or maybe someone needs to hook a bra. We need to have that ability to reach behind our back. It's very, very important. Post-operative rehabilitation is something that we work in concert closely with the orthopedic surgeon. We will follow a protocol, and within that protocol, often we start with range of motion exercises. This is a very common maneuver. Post-surgery, we might be working with a person, we might short range. When we have patients with shoulder impingement or a pinched tendon, we'll work on this direction of movement. To start with our rehabilitation, as I had mentioned before, we use range of motion. So we might use an exercise ball to work on full range before we actually even throw the ball. So once we get to the point where they have the range of motion, they can throw the ball. Our next steps in that process would be, for example, using a pulley or a stick to assist with that range of motion. We then progress to isometric strengthening and isotonic strengthening, like with rubber bands, like a TheraBand, things like that to help build strength. Then we work towards functional things, like reaching into a cupboard. A common piece of equipment that we use in physical therapy is elastic tubing. This is a tubing or band, usually non-latex. It's something that we can integrate into strengthening exercises with a patient. We work on rotator cuff strengthening very often with this type of exercise. Maybe we do a single arm, we can do a double arm. Shoulder problems take time to work on. It's not something that's going to get better overnight. When we work with a person, we want to teach them and educate them on their problem, and part of that education is giving them a little bit of a patience and showing them it'll get better. The key is to continually work on it and not give up.